If you can craft a picture that is shared by many, many people in the organization, it helps you keep that view in the future that if you do these things collectively together, the organization's going to benefit, people are going to benefit, your employees, your physicians, your patients are all going to benefit.
When you look at the delivery of healthcare today, if you put the patient at the center of the focus of all that you do, I don't think you can go wrong.
Connecting with people, being able to make a difference, one life at a time of who we treat.
IT is a major contributor to Loma Linda's desire to be world-class. One of the important parts of IT is to really help automate the workflow, and most of the workflow in healthcare is demonstrated in paper. That's the medium that we work with. Our goal is to help get to a digital environment so the information can be managed in a more efficient way.
If you have the tools that you need, the patients are going to be better served. You're going to be able to deliver safer, quality care, and they're going to see that in your care of them.
We've really moved down the road towards electronic medical records, towards a number of the IT functions that really will support the quality and service in our organization. Supporting our physician partners, supporting our nurses and other clinical professionals as well.
We focused on improving the patient experience in the registration process. How do we have a seamless access for those patients? How do they get into Loma Linda? How do they make appointments? If they have questions, who do they call?
Do you call the small clinic that might be off-site? Do you call the clinic that may be on the Loma Linda campus?
Can they give their information once, or do they need to give their information 5 different times? Those are the sorts of things that we worked with our clinical leadership on very, very rigorously. And our physicians have really helped us because they hear from the patients what the patients want and what the patients need. This is a team effort. This is something that we will have to do together.
Over the years, we had developed some inertia around the processes, the systems, the workflows and technologies. Changing that, I think, was a high calling and a very challenging one. I think ultimately people understand why we're doing things, understand how we're doing things, and we get better collective engagement.
There is a direction of how can we better work together to provide services that's patient-centered and well-integrated.
We're going to do the right thing for the patient, and we're going to do it the right way, such that the patient is treated with respect and the process is efficient from the very beginning when they first enter our roof to the very end when they go home.